with Rachel and changing her diaper, and I can remember a sweet smell in her urine. Nothing that we ever experienced with Sarah. I called Sonia in to smell too.
The smell wasn't real potently sweet smelling, but it did have a maple syrup-like smell. I didn't think about it being anything serious.
Their lack of concern, however, is short-lived. When less than 48 hours later, the Webbs are jarred awake by a blood-curdling sound.
We were woken up by Rachel's screams. I call it a screeching cry. It's just a very eerie cry.
Her whole body would turn red. She would just hold her head back and cry. Her whole body would bend up. I had never experienced crying like that.
Rachel cries incessantly for the next 2 days, stopping only for an hour or less at a time to sleep.
And just hearing that so often was very distressing and upsetting because I was unable to do anything about it, and I was her mom. I should be able to, pacify her and make her content.
At Rachel's 1-week checkup, the Webbs asked the pediatrician about Rachel's non-stop, ear-piercing crying fits.
And during the visit for the checkup, she did have a full physical. The physician listened to her heart and her lungs. He did the thumping sounds on her abdomen. The physician said she just has colic.
Colic is a condition in which an otherwise healthy infant cries for more than 3 hours a day. Doctors suspect that an immature digestive system triggers the fits.
Hearing the physician say that Rachel had colic was a big relief. We'll get through this and it'll go away eventually.
But it's not long before a disturbing new symptom emerges. The baby won't eat.
Every time you would try to feed Rachel, you could only get a few ounces in her. She would suck the nipple 2 or 3 times, and then she would turn her head away.
We were actually forcing food on her. It was very scary. We went back to the local pediatrician.
After performing a careful exam, the doctor is also alarmed by Rachel's weight. It's clear she's behind the standard growth curve, so he switches her to a different formula and offers Sonia some advice.
We had a nurse come up and make sure that we knew how to feed Rachel using the bottle. I can remember thinking that was a bit unnecessary. I felt like I knew how to feed Rachel.
Despite their growing misgivings, the Webbs follow doctor's orders, praying that the colic and feeding problems will soon subside. Little do they know, the worst is yet to come.
I was changing her diaper. Her eyes were open, but she was staring off in space. I mean, her eyes wouldn't even blink. She didn't even notice that you had even run your hand in front of her face. She wasn't there in her body.
When I walked in, I remember looking at her and thinking something is terribly wrong.
Sonia immediately goes into nurse mode, tapping Rachel's feet and pinching her skin. But no matter what she does, the 3-month-old remains unresponsive.
I didn't know what in the world was happening with her. We immediately went to the hospital. It was a very scary ride. I had Rachel with me, holding her and making sure that she was still breathing. My heart was pounding. I was scared to death. And I was truly fearful that Rachel was going to die.
Sonia and Sherwood Webb have just found their 3-month-old baby, Rachel, in a strange and terrifying state. She's simply not responding to them in any way. In a state of panic, they've rushed her to the local emergency room. And now, doctors are trying to figure out what's going on.
Having to give Rachel up was very helpless feeling, scared to death that will she make it? Will I see her again?
As the Webbs wait anxiously, the medical team performs a head-to-toe exam and runs some preliminary tests.
Felt helpless, not being able to do anything for her. She was laying there, and they were just running all these different tests, and all the nurses and doctors were trying to find out what was wrong with her.
Making matters worse, Rachel's body appears to be growing more rigid by the hour, leading doctors to suspect she could be suffering from a severe infection.
They thought that she had meningitis. Sherwood and I both were extremely upset.
Meningitis is an inflammation of the membrane surrounding the brain and spinal cord, which can be fatal if it's not caught in time.
They wanted to do the spinal tap, and that's when they stick a needle in her back and draw fluid off of her spinal cord.
The wait is almost unbearable, but 6 long hours later, the findings are in.
The test for spinal meningitis come back negative.
Hearing that Rachel didn't have meningitis was great, but it did not relieve my fears any because I knew something very serious was wrong with Rachel.
And as the night wears on, Rachel seems to be deteriorating right before her parents' eyes.
Rachel was very lifeless-like in that crib. I noticed at that point Rachel had some curling in of her hands in an upward motion, which I knew was a serious sign of neurological problems, and I knew that something terrible was wrong.
But when Sonia suggests that they bring in a neurologist, the doctors shrug her off.
And I knew that if somebody didn't do something quick and find out what was going on with her, that she may not make it.
I wasn't getting the answers that I wanted to hear. I wanted her to be wherever she could receive the best care. I arranged for the rescue squad to come to the hospital to transfer her to Pitt Memorial Hospital.
The next half hour is agony for Sonia and Sherwood as they follow behind the ambulance.
I was probably the most fearful that we would not arrive at the hospital in time for Rachel to be saved.
The moment they arrive at Pitt Memorial, a team of doctors led by pediatrician Dale Newton whisk Rachel away to the pediatric intensive care unit.
We drew additional blood samples and urine samples looking for infection in her blood or in her urine. Those cultures came back negative.
She was just laying there. We had all these needles and IVs running in her.
We weren't sure what was going on. And because of not being sure what was going on, we weren't sure exactly which interventions to provide.
But the tests do indicate that Rachel's blood sugar levels are very low. So Dr. Newton orders an IV of sugar water for the infant right away.
Immediately started IV fluids.
We clung to that hope that something was going to happen, something was going to turn around.
When we first started giving her fluids, over a course of hours, she did seem to slowly improve.
She would open up her eyes, and she didn't have a distant stare.
To see Rachel look at me, we felt like we were moving in the right direction.
As a next step, Dr. Newton decides to try feeding Rachel the old-fashioned way.
She had been fed most recently 10 hours prior to transfer, so we started a small amount of feedings.
Sonia and Sherwood go to bed that night, hopeful that Rachel is on the mend. But when they arrive at the hospital the next morning, they're completely taken aback by the state their daughter is in.
Rachel went into a coma.
A coma is very serious because it means the brain just isn't functioning normally. That affects breathing, that affects heart function. The child can die with that.
I felt like my worst nightmares were coming true, that I was going to lose a child. She didn't respond to my talking to her or holding her hands. It was just very difficult to see her like that.
Just hours ago, 3-month-old baby Rachel Webb seemed to be coming around. But now she's fallen into a coma and is literally hovering between life and death.
At that point in time, it was still very much a mystery as what was going on with this baby. Why is the child in this coma? The survival rate for an infant in this type of coma, probably 25%.
At a point in your life when there's no hope and there's nothing that you can do when it's all out of your hands. I mean, it's very easy to lose hope.
I have 3 sons, and as a parent, I could only feel the angst that I knew this family must be going through, dealing with a baby that was potentially going to die.
The thought of losing my child was something I felt like I would not make it through.
While the Webbs do their best just to keep it together, Dr. Newton takes a step back in an effort to determine what may have triggered Rachel's initial recovery just 3 days ago.
When we first saw Rachel, we were giving her fluids intravenously to try and rehydrate her. She seemed to improve.
Dr. Newton decides to recreate the circumstances in which Rachel recovered, pulling her off all her IVs except for the sugar water.
Rachel started responding. She would look at us.
She had movements of her eyes and mouth and increased muscle activity as well.
Finally, Dr. Newton thinks he may know what's behind Rachel's mysterious decline. And to confirm his hunch, he performs one more blood test.
We were just waiting for the result from the test.
That wait seemed like forever.
From the blood test, it was clear Rachel had maple syrup urine disease.
Maple syrup urine disease is an extremely rare genetic disorder. In a healthy individual, certain enzymes break down amino acids found in protein-rich foods. But in patients like Rachel, those enzymes are absent, allowing the amino acids to wreak havoc on the brain.
Maple syrup urine disease is a deficiency of an enzyme necessary to break down 3 amino acids, leucine, isoleucine, and valine. These amino acids are in every protein: milk, meat, soy. You can't have food without these amino acids in it. Basically, the formula she was eating was killing her because of her inability to metabolize those 3 amino acids.
Initially hearing maple syrup urine disease, I thought, what a crazy name.
The name maple syrup urine disease is because the urine characteristically has a smell like maple syrup. A breakdown product of one of those 3 amino acids, specifically isoleucine, smells like maple syrup.
I just remember thinking, I've never heard of it.
With the diagnosis in hand, it's now clear that Rachel's crying was not a result of colic at all, but rather the first sign of the disease setting in.
She was crying and irritable because the amino acids were building up in her brain, making her abnormal.
But by the time Sherwood found Rachel completely unresponsive, the amino acids had already reached a toxic level.
Rachel started to become non-responsive because of the increased levels of the amino acids affecting her brain.
As her brain began to shut down, Rachel's body soon followed. The stiffness that doctors mistook for meningitis was also symptomatic of the disease.
Rachel didn't have normal muscle tone because the increased amino acids in the brain affect all brain function, and that would include muscle activity as well.
Ultimately, the toxins built up to the point where her brain could no longer perform critical life-sustaining operations.
The coma is just sort of the ultimate end result. The brain is functioning so poorly that it sort of shuts down.
Rachel's diagnosis has come not a moment too soon. Had her disease progressed any further, it would almost certainly have killed her.
When we saw the symptoms that Rachel had, we saw how serious the disease was, that she could die, and that most children do die within a week of life if they're not diagnosed. We felt very thankful because she had survived.
Harrowing though Rachel's ordeal has been, there is a relatively simple way to keep toxic levels of amino acids from building up and attacking her brain.
Treatment is basically to provide a formula where those 3 amino acids have been removed.
And within just a few hours of receiving the new formula, Rachel begins to slowly rebound.
It was great to finally see her respond to me, to look at me.
We knew that she would recover. We just didn't know how well she would recover, how fully she would recover. Our understanding would be that the elevated levels of the amino acids in the brain cells for those first 3 months of her life, they poisoned some of the brain cells so severely those cells could never fully recover.
Only time will tell if Rachel will be able to walk or talk someday.
We were just kind of blown away. But what will happen next? We didn't know what the future held.
As they contemplate what lies ahead for their daughter, the Webbs can't help but wonder why Rachel wasn't diagnosed sooner.
With all the things that medicine can do, it seemed odd that it would take so long to figure this out.
It was tricky to diagnose because, first and foremost, it's so incredibly uncommon. Around 1 in every 200,000 births have maple syrup urine disease. And the initial symptoms were so nonspecific. Testing for maple syrup urine disease is now a part of newborn screening in all 50 states.
Today, Rachel is bravely living with a disease that changed her life forever.
Rachel's doing well now. She is 17. She's in regular school. She's physically disabled.
She has trouble with speech articulation. She speaks and knows what she wants to say, just has trouble getting it out in a way that you can clearly understand.
My name is Rachel. I feel like she's I haven't been
But just